Guys, it's Martin back at Reform Body Clinic in Ottawa's Bayard Market. I just want to give you a little primer on posture. I've just been invited to do some virtual workshops and they're going to be based around sitting up straight and this new reality of working from home. So I'm not going to talk so much about ergonomics. I will shoot a separate segment on what to look for in ergonomics, especially if you're at the computer, because you know what, at the dining room table or kitchen island is not great. Lying on your bed's not great, but that's a whole video for itself. I'm going to give you a baseline postural lesson from top to bottom, and this is something you can work on between now and the next video, because your posture relates to your spine. Obviously, your posture relates to your spine. I mean, even your mom knew that when she was telling you to sit up straight when you were a kid. But here's what may be the leap for you guys. Your spine now relates to your body giving you low back pain, stiffness, mid-back tension, shoulder blade tightness, upper neck, even all the way up to headaches. That all ties in to how you sit. And for those of you who've been in an office setting with great ergonomics or maybe an assessment done in the past, but all of a sudden you're home, this is for you. This is going to be your baseline, okay? So I wanted to start this video facing you guys because I'm on a straight back chair, hard base. And what you've probably done in the past is if you kind of really wiggle to the end of your chair, just sit on the last 2 inches, it forces you to sit up straight. Because if you go too far forward, you're going to fall off the chair. And if you round your back too much, you're going to feel really strained, but your back will touch on the rest. And you'll know that that doesn't do good things for your spine. So try this at home, wiggle forward, get your sit bones, your technically what's called your ischial tuberosities, those bony bumps, on the edge of your chair, and it's going to force you to sit up straight. Simple, okay? And by straight, from a medical perspective, your ear is over your shoulder is over your hip, okay? I'm going to do this sideways so you can get not a 3D view, but a side profile of the same thing. So when you have your office chair, especially if you've been sitting it for a long time, you're likely to slowly get comfortable like this. And without the word of a lie, your spine will eventually deform into that rounded position. And you guys all know that, the head forward posture, okay? Sitting on the very edge of your chair forces you tall. And the angles I would look for, back to the ergonomics a little bit, are 90 degrees in the knee, 90 degrees in the hip, literally 90 degrees in the elbow. So your keyboard is actually quite low from an ergonomics perspective. But what you're going to see here is when you're on the edge of the chair, you're very, very tall. But you all know that after 30, 45 minutes of work, this starts happening. And if you're in the office setting, you know people who sit very rounded. If you have kids at home, and I implore you to pick on your children, hopefully your mom picked on you as well, that they love this computer posture, especially now that, from a grade 4 or 5 up, they're doing tech all the time. So from this tall posture, guys, you can actually stretch your back a little bit by rounding it. It shouldn't feel good, and then getting tall again. And I'd love you to really think about this proud chest, strong low back, and that 90-90 when you're sitting, okay? So how does this cause you problems? Like, here's the thing with posture. Just like anything that we kind of bend and hold in a bent shape for a long time, eventually your spine will have permanent deformed. This is a problem. And I'll just kind of give you the revision. So if this is me facing you, this is me facing the side, this is me sitting tall, this is me sitting rounded. Everybody knows somebody or you can visualize, you don't see a little old lady walking through the mall hunched over. That's a spinal problem. Why I wanted to shoot this is when you have headaches, if you sit like this and you have headaches, there's no wonder why you have headaches, because all that pressure is on your neck, and we know the joints and the muscles in your neck cause headaches, right? Simple. The pressure in the lower neck with this is incredibly high, so stiff neck, this side upper trap levator scap tension, chronic shoulder, you sleep on your shoulder and it goes numb, even arm pain. Well, that all comes from these nerves in the lower neck, and it's all related to how you hold your spine. Burning between the shoulder blades, or pins and needles, or tension you can't get rid of, all have, posture is the common element, bad posture. And of course, without having to, flog a dead horse, if that makes sense, the same thing with the low back. As soon as you put pressure on your low back, you're going to put pressure on joints, pressure on nerves. You can get, chronic stiffness, tightness. You can be more prone to just throwing your back out, having an acute injury. And eventually when these nerves get bad, you can have a sciatic, like a numb leg. So I just wanted to shoot that for you really quick today, because, every second person I talk to, but like literally every first person I talk to is working from home. They may be on a graduated office here and there, but for the most part, they're home all the time. So when you think about this postural side of things, bad posture is okay for a couple seconds as you reset, but as a general rule of thumb, bad posture catches up with everybody, right? And the big problem is posture is directly related to your spine. Your spine is directly related to your nerves, and your nerves now will give you pain and problems that, you don't want them. You want to live a healthy, vital life, and this would be the foundation between this and if you need to get your spine assessed. So if you have kids, tag them, have them watch this for good posture. It's incredibly important for them to learn this early. And for you guys, whether you're patients in the office or not, just think about these simple, basic things. Go through your world. Make sure you are tall, strong, proud, no matter where you work from. And you can share this or tag this with as many people as you like, okay? Thanks so much. Take care. It's Martin from Reform.